Welcome, I'm Barrie-Louise Switzen. I don't know about you, but I'm thoroughly confused between Medicare and Medicaid. Our guest today is going to try and demystify this little quandary for me. She was with the New York City Medicaid system for 15 years before starting out on her own, where she does consulting for nursing homes and private individuals. And I would like to introduce and welcome Teresa Civello. Terry, thank you for joining me today.
Thank you for having me.
Please explain to me and our audience, what is the difference between Medicare and Medicaid?
Well, Medicare is a federal program which people are entitled to receive when they are 65 years old. There's a Part A, which is the hospitalization, and the Part B, which is optional, but almost everyone gets, which covers the doctors and anesthesiologists and ambulatory services. Some other people who can also receive Medicare if they're under 65, for example, people who are on dialysis, kidney dialysis, and other people who are on Social Security disability for 24 consecutive months can be covered by Medicare. Medicaid, on the other hand, is a program which you have to apply for and has a lot of tests.
Tests?
Tests, like financial tests. So you need to qualify for Medicaid, so it's not automatically given at a certain age or to certain groups or for a diagnosis, for example.
Is there any time when you could have both Medicare and Medicaid?
Yes, you can. A lot of seniors have Medicare and Medicaid because Medicare does not cover a great many services. For example, Medicare does not cover prescription drugs. It doesn't cover certain kinds of home care. It only covers up to 100 days in a skilled nursing home. So some people need assistance in paying or supplementing what Medicare does not pay.
Well, how do you qualify for what Medicare doesn't pay, subsidize rather?
Well, what happens is you can have actually 3 insurances. You can have Medicare, you can have a Medigap insurance, which most seniors buy, like a Blue Cross or an AARP, and that pays for example, the 20% co-insurance that Medicare requires a senior to pay. They pay 80%, you pay 20%. And you can have Medicaid, because Medicaid will cover the services that Medicare and even your Medigap doesn't cover. Prescription drugs is a really big one, as is home care service and nursing homes, transportation to and from physicians, to and from clinics. All of that is covered by Medicaid, whereas it's not covered by Medicare.
Okay, so can a person have private insurance as well as Medicaid?
Yes, you can have Medicare, private insurance, Medicaid. You can have private insurance and Medicaid. Medicaid is the insurance of last resort. That is, it's the payer. It pays after all your other insurances have paid.
So then, in other words, it almost behooves somebody to have private insurance as well as everything else.
Right. It's very important, I think, as we're moving into the next century and Congress is revisiting Medicare as we speak practically, that they're really looking at the cost of this program and whether there'll be any services or any money available for this program for people who will be reaching 65 within the next 10, 15 years, the baby boomers, for example. And so they're looking at cutting back on some services. They're also looking at possibly imposing a financial test or increasing the cost of the Part B, for example, based on income and resources. From my point of view, I think that will cost more than possibly the savings that will be gained, because you'll then be setting up a means test which requires
staffing and everything else.
Staffing, proof of eligibility, proof of income, proof of resources. Having worked with Medicaid for 15 years, and even now, that's a nightmare. So it would be a shame to see the Medicare system moving into a means test.
It's going to be really difficult.
Yeah, because they really can look at other ways in which they can save money. They could look at the ways in which The providers bill for services. Now, they just recently had a report out from the federal government on Medicare scams and how it is
They're getting
relatively
worse.
easy to scam Medicare and bill for services that have not been provided, et cetera, et cetera. They could also look at some of the services that Medicare pays for and whether they're cost effective. For example, you need a wheelchair.
Right.
Instead of Medicare paying maybe the $1,500 for the wheelchair, they don't pay for the purchase of it. They pay for the monthly rental, so that in the end, your wheelchair could cost more than a Lexus or an Infiniti.
It's almost like the $400 hammers that the Army was buying.
So there are little things they could look at before they think about slashing.
Well, let me ask you, there's been a lot of advertising on the different HMOs to join. What is your feeling about the HMOs versus a regular insurance company and being supplemented by Medicare and Medicaid?
Well, right now, there's a lot of marketing for Medicare managed care programs. And I think that's wonderful, except that right now, there is almost a marketing towards the very, very young, well senior.
Oh.
Because a lot of the marketing programs take place in restaurants where you drive and where well seniors gather and dance and have a good time. So I'm concerned about the marketing of this and that they're collecting the premium for well people when in reality almost every senior who eventually uses Medicare to a significant degree uses it in the last 60 to 90 days of his or her life.
Oh, that's interesting. We're going to have to take a break right now, and I'd like to find out, how do you work on this? I mean, what do we do to prevent us from being in this trap here? And we'll be right back, and stay tuned. Don't touch that dial. Please stay tuned. You are watching The Woman's Connection.
From birth to age 3 are the most important years in a child's brain development. The time that defines who they become.
Okay, great. Thank you for joining us. I'm Barrie-Louise Switzen, and my guest is Terry Civello, and we're talking about Medicare and Medicaid. Today, we find more and more people being called the sandwich generation, where they're taking care for their elderly parents, and they're taking care of their children, many of which are in college.
Right.
Do you have any suggestions for this so-called sandwich generation?
Well, I must say it's a really uncomfortable situation for people to be in because they almost have no time for themselves. I think that there are a lot of women who still are predominantly the caregivers of America, even if they're working out of the home. They're taking care of elderly parents or perhaps the surviving parent. And they're also trying to manage their own household, perhaps with college students as children, or children who have returned home after divorce or loss of job.
So what would you suggest they do when they find that they're in this catch-22 position?
Well, I think the first thing they should do is really find out whether or not the parent is eligible for Medicaid, because Medicaid can really provide some of the services, particularly home care, support services in the home, is a major area which Medicaid covers and Medicare does not.
What would you suggest they do? I mean, who would they contact to find this out?
That they can contact their local county Department for Aging or Department of Social Services and get some information about Medicaid. The state puts out a booklet which all the counties supply to inquirers. And then they can get a little more sense about what the program covers and what the financial criteria are.
Now, let's ask another question that pertains to the younger generation, okay, like a child who's injured and they're immobile for almost life sometimes. Are they qualified for Medicare or Medicaid, or?
Well, they would be qualified for Medicaid because they wouldn't have Medicare coverage because they're not 65 and they haven't worked in Social Security to have 24 months of Social Security disability. And these are very tragic cases, and they're not as infrequent as we would think. And Medicaid really is the insurance that covers from, birth to grave, and covers such tragedies as, for example, head trauma. A lot of kids are on these dangerous rollerblades and motorcycles and skydiving, and there are accidents, and those can result in paraplegia, quadriplegia, very much like Christopher Reeve's accident that left him severely paralyzed. Medicaid can pay the cost of all of that care.
So in other words, a person who, well, not a person, but a child of a family does not have to put them into a financial strapping situation where they have to sell their home or they have to give up all their life savings or not put all of the other children through college.
There are special Medicaid programs that deal with children who are very, very, very chronically or catastrophically ill that allows the parents to still have the ability to take those children home, but not be financially responsible because the home becomes almost a hospital.
Oh, interesting.
And as a result, after 30 days, parents are not financially responsible for institutionalized children.
Oh, I didn't know that.
So under President Reagan, there was a new program which we call the Katie Beckett program, named after this child in Iowa, I think, where she was in a hospital. Her parents had to see her every day, and they couldn't bring her home because if they brought her home, they would be financially responsible. So the president said this didn't make any sense.
Right.
Why don't we turn her home into a hospital room? And that's what they did. And so this program is a real benefit for children and their parents.
It sounds like the whole family benefits from this, because then the children, the other siblings are not so-called penalized or something.
That's right. They are part of the family, the child is part of the family, and in a sense there's a home life as opposed to running back and forth to institutions, getting babysitters for the other children, having the other children feel very neglected emotionally.
What about long-term care? Would you suggest people buying long-term care insurance? And if so, at what age would you suggest that they look into this?
Well, given what's happening with Medicare and Medicaid on the federal horizon, I would think that most long-term care in the future is probably going to be funded by long-term care insurance. And so while it's kind of hard to think about, when you're 50 or 60 or even 40, if your company where you work offers a long-term care insurance benefit even as an option, I would take advantage of it because the policy you buy at 40, those premium costs remain the same up until you're 80.
Well, what are the things that you would look for in a policy?
Well, in New York State, we're very fortunate because we participate in the Robert Wood Johnson Foundation waiver. And it's a special program where if you purchase long-term care insurance for a certain period of time, then you will be able to keep the majority of your assets, even if you go into a nursing home and after 3 or 4 years require Medicaid.
Well, wait a minute. What's the length of time that you have to be buying a long-term health, long-term care insurance?
Well, you should have it for about 3 years before Medicaid would kick in, and they would allow you to retain your assets rather than spending them down.
Oh, that's interesting to note.
Yeah.
Well, I'd like to pursue this again
Good.
when we come back from our break, because this is fascinating.
Believe me, it's important to all of us.
And I never knew you had to you could keep it for like 3 years prior to and this whole thing. Stay tuned, we'll be right back.
Be cool about fire safety.
Who are you?
See more smoke. Smoke detector. The more smoke I see, the more noise I make. And I see more smoke coming from that toaster.
Oh my. Thanks for warning us, Seymour.
That's my job. I hate smoke. It's disgusting. It gives me a headache. So whenever I see it or smell it, I make this noise to warn you. Because where there's smoke, there may be fire.
Good tip, Seymour.
How many smoke detectors do you have in your home? Count them. Is there one outside your bedroom? There should be. Tell your parents.
Be cool about fire safety.
Any other questions? But we're not, we're up. Thank you for joining us. I'm Barrie Switzen, and I'm talking to Terry Civello, and we're talking about Medicare and Medicaid and health insurance policies. So in other words, you're suggesting the earlier that you get into the long-term care insurance program, the better you are off as an individual as well as your family.
Right, because you are purchasing the insurance at a younger age.
Right.
So that your premium is much less.
And it'll stay less for the entire
Right,
policy.
right.
Are there certain key points that you should look for as far as when you're buying something like this?
Well, I think what's very important is to look at whether or not the policy covers both institutional and home care services.
Okay.
Because those are two options that are, in fact, very important to have available to you. In addition, you want to make sure that the criteria for the long-term care insurance policy and when they will pay will be something that will cover you even if, for example, you are in a chronic disease that will not get better. Several years ago, the policies would not pay for nursing home care, for example, unless the outcome from the stay in the nursing home was positive. Now, if you have a chronic disease that's not going to get better or will result in death, then the policy wouldn't have paid. A lot of that has been changed with the sophistication of the insurance companies and also the demands being made by state governments.
Oh, interesting. Let's go back. Let's say you're in a quandary and you've got all these forms you've got to fill out and you want help, or you know you need help but you don't know where to look for help. Okay, you need a professional provider to help you get through all the paperwork.
The first thing I would suggest is if the parent or the person is already in the hospital, start speaking with the patient accounts department of the hospital, even if there's insurance to cover the hospital stay. Or speak to the hospital discharge planner. They can get you started on dealing with the myriad papers and documents that you will need to get Medicaid. And by the way, I know that it's a real struggle, in a sense, to weave your way through all of the paperwork, but the results of that effort are very rewarding because Medicaid is the most generous insurance program there is. It pays for services that most other insurances don't pay, unless, of course, you're with the federal Congress. They have the best insurance program.
Well, I think that leaves out quite a few of us.
Right.
You mentioned about prescription drugs earlier. How do you know when you're covered? Or is there a way that you can be covered under Medicaid or Medicare?
Well, let me say this, that you have to look at first your insurance policy, whether you're working or whether you're retired.
All right.
A lot of retirees don't realize that their companies have taken out prescription drug plans for them. A great many of those plans are through the mail and have a flat cost attached to each prescription. So the first thing is to investigate the insurance you currently have. If you have Medicare, You do not have prescription drug coverage unless your HMO Medicare program is offering that as an incentive. If you have other high drug costs, then you can look at the state EPIC program, which is a drug program that pays a part of your prescription drug costs. You would have a cost share in that. And if all else fails and you cannot afford to pay for very expensive drugs, then you should check out Medicaid.
Because there's like what's AZT for people who are HIV positive
Right.
or who've got AIDS. That is such a horrendous expense
Right.
from what I've been reading about.
It's very expensive, and actually all of the new formulas that they're using with all of the new drug concoctions, they're like, I think they call them milkshakes, are very, very expensive, and Medicaid does in fact pay for all of those drugs. But even if you were having a coronary problem, or you were just coming out of the hospital having had coronary bypass, your drugs, just for the first few months post-op, could be $200, $300, $400, $500 a month. Diabetics have very expensive drug costs.
Is there any way that people can cut their medical expenses?
Short of the medical profession finding cures for every disease, I don't think so. But I think that they can try to make sure that they are covered, to know what they're covered for, and to be careful about the drugs they currently take. A lot of older people, particularly, you'll see their bathroom shelves lined with a series of bottles of drugs. And sometimes they go to different physicians. So one physician doesn't know what the other physician has prescribed. So I
That's
think
not
that
good.
that's very important, is to always keep a list of all the drugs you are currently taking or have taken in the last year. And also keep track of the chronic incidents that you've had throughout your life, so that better enables the physician to prescribe medications or to treat you knowing more about your medical history.
And that also cut down on your recuperation time,
That's right.
because
That's right.
once they know your past, they can help
Right.
correct the future
In
quicker.
fact, the insurance companies are all beginning to look at alternative medicine. Some of the larger HMOs are looking at acupuncture and holistic medicine.
Oh, I
and-
like that.
Yes, because they begin to see a benefit for their patients and their subscribers.
Well,
And
there's a
some-
lot to it. I mean, people, I wonder if it's the AMA who's poo-pooing it all or not, or maybe if we talk about that, we get into a whole political discussion here. But in the meantime, unfortunately, we're running out of time, and I wanted to know, do you have any advice for our audience?
Well, I think the most important thing is to begin to plan early rather than to look around after a catastrophe has occurred. And also ask your friends if they know of anyone who can help. But more importantly, check with your hospital departments of discharge planning and social work, because they really do know a tremendous amount, and they have a lot of resources that can put you on the right track. Or
And
you
if-
can call someone like me.
And how will they get hold of you?
Well, they can call me at, my office number.
Which is?
212-473-3491. And I'd be happy to come out and do an assessment evaluation of the circumstances and then help them plan for the future.
Well, thank you very much, Terry. Thank you so
Well, thank
much
you,
for
Sarah.
joining
I
me
enjoyed
today.
it very much.
It's been great. I mean, it's overwhelming. And I hope it's been beneficial for you, too. Thank you for joining me, and look forward to seeing you again. Bye now.